I'm going to show you how to fix shoulder instability pain. If your shoulder joint is hypermobile, and maybe you have Ehlers Danlos or another hypermobility syndrome, and especially if you keep dislocating your shoulder, we got to fix that. I'm Dr. Davis. When I was a kid, I used to be able to dislocate my own shoulder intentionally. I could just pop it out and pop it right back in. In fact, I could do it without even using my other hand. So I was very hypermobile. So being hypermobile, I was attracted to yoga because being good at yoga is just being flexible, right? Right? I'm kidding. Yoga's not about being flexible. So I'm going to show you what I've done with people who are hypermobile in clinic, people who are prone to dislocations of their shoulder, and how you can strengthen and stabilize that shoulder and shoulder blade so that you stop dislocating it and have a better time and have less pain. Okay, we're going to start in kind of a plank, a knees down plank. And if this is too hard for you already, if just being on your hands and knees is too much for your shoulder, you really need one-on-one guidance. I do work with people online to come up with rehab programs. Go to the link in the description and we can work one-on-one. But basically we start from like a tabletop position and then walk the knees back a little bit so that we're in a plank. And really, we're just gonna hang out in a plank. This is it. So the way that I want your shoulders, so we wanna try a couple things. So push, push, push into the ground, and then do the opposite. Pull your shoulder blades back onto your back, right? Now, some of you, your shoulder blades are actually going to pop out like that. Watch my shoulder blade. See that? Pretty crazy, right? So I have hypermobile shoulder blades, but I can control it. So here we are. And instead of having my shoulder blades pop way out, I pull my shoulder blades into my armpit. And then we just stay here. We try to hold here for 30 seconds, try to hold here for a minute, eventually work your way up to a minute. But really what I'd like you to get used to is forearms down. This is really where I'd like you to start, is a forearms down plank. So from this position, I mean, you may want your knees a little bit closer, just so it's less of an ab exercise and more of a shoulder exercise. But we first start with isometrics. So we get used to holding the position without moving. It's going to be the easiest thing for the shoulder. Once you've worked your way up to being able to hold for a minute, then we can add some movement into the routine. So phase 2 is the same thing. We kind of have our shoulders, our elbows under our shoulders, and then we add some movement side to side. So we just go off to the side here, and then we go off to the side here. And we do maybe 5 repetitions on each side, and then we would take a break. So work your way up to being able to move here. And now watch this. If I move here and my shoulder blade pops out, see that shoulder blade popping out? That means I don't actually have the stability to be here. So if I can move over and push my elbows into the ground so my shoulder blades stay in my armpits, I'm gonna have a good time. Once you get good at that, we can use a ball and come out here into a forearm plank with our knees down, and we can stir the pot. So we just slowly try to draw a circle, and we go all the way around, and we'll do circles in each direction, nice and slowly. And again, we're trying not to make our shoulder blades pop out of our armpits. So nice and strong, push your elbows into the ball. Eventually that'll be too easy. I like to take a kettlebell bottoms up, so the bottom of the kettlebell up, and just hold it here. So you can just hold and don't go anywhere. Once this is too easy, then we can get up with the bottoms up and just walk around the room back and forth with the bottoms up for 30 seconds to a minute. Just walk around, and you have to balance because the kettlebell wants to wobble. And if you can stabilize your shoulder against this, then you're gonna have better control over the muscles that hold your shoulder in place. Once we get used to that, we need to do some basic pulling and pushing movements. So if I have a band here, this is just a bunch of stretchy bands and a loop around the end, then I can stand here and pull and then relax. So my entire body is like a statue, nothing else moves. I just pull here and relax. If I show you with this arm, my forearm remains parallel to the ground, and then I relax. Now I'm allowing my shoulder blade to move forward here, and then I pull my shoulder blade back, and then I pull my elbow back, and then I let the elbow go, and then I let the shoulder blade go. Don't overthink it too much, but the point is that there should be a coordinated movement between the shoulder blade and the actual arm. And then you would want to do the same thing with the pushing motion. So again, you grab a band, and then you push out and come back, and just get really good at pushing. Once these things are too easy, we'll do knees down push-ups, but we're only gonna do partial depth. We're not going all the way to the floor quite yet. You start off knees down with just a tiny push-up and come back up. So we just do little tiny baby push-ups and get really good at this without your shoulder blades popping off of your back. So do tons of these, give it weeks and weeks and months really to get used to this. And then you can add depth and maybe you can go all the way down, but don't force it. Eventually, it'll be time to pick up some weights. A favorite of mine is just to bend over and do some rows here, where we pull the shoulder blades onto the back and relax back down. So shoulder blades come back, and then the weights go up, and then we relax everything. Shoulder blades back, weights go up, and then relax everything. And once you get to that point, really you're ready for normal weight training. And then it's time to really stabilize that shoulder with good strengthening and good weighted exercise. And yes, that's safe. And yes, it's good for your body, even if you're especially if you're hypermobile or you have like Ehlers Danlos, or a lot of times people have Ehlers Danlos and they also happen to have fibromyalgia. Those two just tend to go together a lot of the times. Weightlifting is safe and effective for pain management with both of those conditions. Again, if you want one-on-one guidance, you can always work out with me one-on-one. Remember, movement is medicine, motion is lotion. I'll see you in another video.